This video is about how we develop the skills around the hows and whys of pain. Now, in reality, there are some skills that were harder to develop because they were more obscure, and pain is one of those. For example, comparing it to communication, what we learned was that if a woman shook her head no, or held her hand up, or her finger up, that was a lot easier than smacking a man's hand away, glaring at him, or yelling at him. It was more effective. However, what we also learned was that if a woman shook her head no, held up a hand, did something like this, that the person helping her, her partner or other, didn't know when to help again. So she had to indicate a yes as well. And the yes wasn't just nodding your head yes. It was more likely taking the person's hand and putting it someplace on your body where you want to be touched, or explaining to them when you have a moment to explain how they can help. And explaining can be very short words like, breathe with me now, or look me in the eye. But when it came to pain, it was more complicated. And here's why. Birthing better skills, as you know now, were developed by hundreds of fathers and mothers just like ourselves. And they started to develop in the early 1970s, when the first ever childbirth classes were being taught. And those were entirely skills, as we've talked about before, Lamaze, Bradley, and Grantley Dick Reed. And it was the Grantley Dick Reed skills that added to the confusion. It was childbirth without fear. And the belief was that if you aren't afraid of birth, that you won't feel pain. There's absolutely no correlation between that. When an obstetrician like Grantley Dick Reed sees women who aren't feeling pain, and he says to them, "Are you afraid of birth?" they're going to say no, because the pain is manageable. But talking about fear is really subjective, and talking about pain is also very subjective. And so birthing better families needed to understand what was being said publicly at that time and what we were doing about it. What we discovered was that the mummy wars were involved in this issue about pain in childbirth and fear in childbirth. In other words, women who weren't afraid and who had relatively painless or manageable labors believed that their lack of fear was directly related to their lack of pain, while those women who were afraid of birth, who had very painful labors, believed that there was a correlation between their pain, between their fear of birth, and the pain they experienced. This sounds like it would make sense until you attend a lot of births. And then what you realize is that there are many women who say that they're not afraid of childbirth and who have terribly painful births. Some manage fine and others do not. In the same way, there are many, many, many more women who have fears of birth because fear of birth is hardwired within us, and yet they have incredibly easy births. So when we look at the reality, there is not an evident correlation between fearing birth or fearing the pain of birth and what your experience is. The word pain and childbirth pain can be so triggering to people that they do not want to discuss it. Birthing Better Families sort of took the bullet between their teeth because we knew we had to discuss it, because we had to develop skills that worked with the fear and worked with the pain, or were there even if you felt no fear and felt no pain, or were there for you if you had no fear and yet you felt pain and were struggling with the difference between how you felt emotionally and what you were feeling physically. One of the questions that we asked ourselves, what is the cause of pain during labor? And we're going to talk about labor now because it's directly related to very specific types of pain. We can have the occurrence of where it's occurring. And this comes from when women and men tell their birth stories. So one is the occurrence of pain. That might be, I found labor contractions easy to manage, but when the baby came down to my vagina, it was so tight and I felt such an intense ring of fire that I just clinched up and my baby's birth was delayed. Or the quantity of pain. I honestly didn't really feel much for the first 12 hours. And then for the last 3 hours, it was over the top. Or the place, exactly. I felt every contraction in my lower belly. Or I felt every contraction in my back. And of course, there are variations of this as well. But the cause of pain during childbirth is the activity. It's as simple as that. We have a big object that is coming down, through, and out of our body. In order to do that, our cervix has to dilate. Our cervix is a very tight ring that has muscle cells and connective tissue cells. That cervix is tightly closed, and it has to be drawn open to this size. That can cause pain. Once the cervix is open, the baby then has to come down into the top of our vaginal canal or birth canal and then come under the pubic bone so that it can open up the vaginal opening. And all of that can cause pain because we have something the size of a grapefruit that's moving down, through, and out our body. Often there is very little pain at the beginning of labor. That's because the cervix is being softened by the contractions and eventually beginning to dilate. But the dilation of a very tight closure, just a little bit, usually isn't where that stretching pain occurs. That stretching pain begins to occur usually somewhere around 3 to 5 centimeters in dilation. Women who have niggling labors often say that they are painful in the sense that they have sensations that are discomforting, but rarely are they intensely painful. And if they are, it may be that you're not having a niggling labor anymore and are actually progressing quite quickly. However, what we discovered is that when we have a pause between contractions and we don't have pain during that pause, then we recover, but another contraction comes. And the closer the contractions are, the longer they are, and the more intense they are, the more we perceive of this as pain or discomfort. And so we wanted skills to deal with every moment of what was happening to us and inside us. And what we found was that during labor, we often had sensations, as we talked about earlier, in different parts of our body. And different pains created different responses. So for instance, most women who have pain in their uterus during labor, that pain subsides in between contractions. Whereas a woman who is feeling pain in her back or her hip during a contraction, that pain often doesn't go away because the cause of that pain is actually pressure on nerves rather than the stretching or tugging of the cervical opening. So we needed different skills to deal with different pains in childbirth. We also discovered, and why we developed skills around the progression of labor, was that if labor did progress, meaning the contractions got longer, stronger, closer together, with increased pain, and what was an effective contraction with a good peak to it, that even though we didn't like it, we were aware that our labor was moving along, and we were more likely and more willing to cope, even if we lacked skills. However, if we felt we were having the same contraction time after time after time, hour after hour after hour, the pain then became coupled with exhaustion, and that didn't make the pain more intense. It made the ability to cope with the pain harder, and why we developed the body skills so that we could recognize if labor was stalling, and we could then create more space in our pelvis to permit our baby to move past that place where it was stuck. The same way with the ring of fire. The ring of fire is at the outlet of the vagina. Perineal massage was meant to reduce it, but most babies that get stuck in the birth canal don't get stuck there. They get stuck way up at the level of the bottom of the sacrum or between the sit bones. So we knew that the ring of fire was an issue, but we knew the whole birth canal, the whole vaginal passage was an issue. So all of it got worked on from 32 weeks, 5 minutes a day, including the outlet, so that the outlet could easily stretch to accommodate an object the size of a grapefruit. Another type of pain or discomfort discomfort for women who are laboring was rectal pressure. Once the baby started to move through the dilated cervix, women often poop. But nobody likes to poop in public. So what do? We clench our butt and try to stop that sensation. And what's that doing to the inside of our body? It's closing it down so that the baby has to work harder to open us up. But what we discovered as we worked on skills around the pain of birth was that, as I said earlier, there was no direct correlation between fear of pain and the pain you experience on an individual basis. And we had to get that through our head because there were so many women who had read Grantley Dick Reed, who had been told through the natural birth movement, don't be afraid of birth. And they had spent weeks in their pregnancy trying to reduce any anxieties or trying to get rid of fear. And they were happy with their accomplishment, that they felt confident and they trusted their birth. And then they experienced during labor pains that were very uncomfortable. It's very disorienting when you come into an activity with a belief about how you should feel. It's hard to change and realize that all the work that you did during pregnancy to subdue, reduce, or prevent yourself from feeling the fear or anxiety of the coming birth was for naught. And here you are now feeling pain. And that is incredibly disoriented. That's why we developed the skills in the positive and negative voice. So you could feel that pain, acknowledge it, and use your skills to manage what was happening to or around you or within you. One of the questions that the birth coach has, women not so much, but the birth coach, somebody who's seeing the woman from the outside, is whether pain is a problem. And often what men would say is, I really thought it was a problem. And then I looked at the people attending her and they didn't seem to think it was a problem. And if I would mention to them, is this pain normal? They would say, yes, this is what childbirth is like. When men didn't have skills, it was really, really challenging to know what to do. He's seeing and hearing his partner experiencing pain and her reaction to pain. And we often attribute pain to there being a problem. Many problems in childbirth do not cause increased pain. Very few do. So we are looking at something in which we see and hear and feel pain, and a problem might be existing that has absolutely nothing to do with the pain we're seeing, hearing, or feeling. For those women who have unplanned cesareans or scheduled ones, we can feel pain as well. And that's why the skills that Birthing Better Families developed were for all births. We can't always take away the pain. And it's curious because for everybody who rages about the medical profession, one of the things that the medical profession did was to reduce the pain. Because when you reduce the pain, you reduce the suffering. And suffering, as I've mentioned in other videos, was the global childbirth goal number 2. Because everyone recognized that women suffered in childbirth. There is no traditional culture that I've ever been to, and I've been to 30 of them, in which they say to women, don't be afraid of birth. As I've talked about in The Gift of Fear, every culture is anxious and fearful during pregnancy, birth, and the newborn period because it's such a vulnerable period of time, and all they have is themselves to rely on. But what we discovered, and one of the great skills, is that pain is manageable, and it's manageable through using skills. When Lamaze and Bradley's skills were developed, they were developed to have a natural birth, pain-free labor without medical care. Women did not have sufficient numbers of natural birth without medical care for those systems to continue. And the pain-free labor was not really perceived of as we manage pain, we're coping better, because multiple millions of us coped better, even though we didn't have that natural birth or the birth without medical care. And as I've said in another video, that just rip-roaring success was totally ignored. If it had been acknowledged, then skills and choices would have come together in the next trend in the 1980s. But because that was never acknowledged as a success, which was the success of the skills, skills were dismissed by famous authors, the natural birth movement and midwives. And we were then told that women don't need skills because cows and cats aren't taught skills, and that we instinctively know how to birth, and that pain is really just a figment of our imagination. And so there was an increased stress on don't be afraid of childbirth, which then added to the mummy wars. And this is one of the things that we're trying to just break. We don't need mummy wars. It's not one of the things we need in our greater society. We need respect for everybody's birth and circumstance, just as we need. The coach's role in managing pain for the woman is absolutely essential. One of the saddest things for us as Birthing Better Families was the message that was given to the natural birth movement in the late 1970s that fathers should no longer be the coach and merely support women's choices and somehow protect the sacred space of labor. The latter was absolutely nonsense. There was no man who was going to ever stand between the woman and the obstetrician, or the woman and the midwife. He wouldn't stand between the obstetrician and the woman because he sees the obstetrician as a trained professional. And he wouldn't stand between the midwife and the woman because he sees the midwife as somebody who knows about birth. So men are never going to protect the sacred space of birth, and they shouldn't be in that role. It's absolutely ridiculous. And I'm sorry to use such harsh terms, but it is ridiculous. You want the father to be helping his partner work through the activity of birthing their baby, because that's how they're going to raise their child as parents. They're going to work together. If you take the analogy of protecting the sacred space of birth, then what's the role of the father after the birth? Well, then it gets into complex social issues, doesn't it? A woman is at home taking care of the child, and the man's role is outside the home, making the money and providing. Is that what we want as a society? It may be what you want as a family, but the reality is that most people and most cultures, men and women, work together to parent their children, and women are not stuck at home tending children while men go out and work. Men and women in all traditional cultures pretty much do the same work and pretty much take care of the kids somewhat similarly. So one of the greatest skills that we learned was to see pain as a challenge and not as a threat. If we met each painful contraction with skills, and we worked through each contraction with skills, or each circumstance with skills, we did not have to like the experience, but we managed well, and boy, were we proud of that. If you choose to use pain relief, that's fine. Continue to use your skills anyway. Women having cesareans will be very numb. However, there is almost no skill in Birthing Better you can't use to work through the activity of birthing your baby, because we have to keep reminding ourselves, what is the activity of giving birth? It is the activity of moving our baby from inside to outside our body, and that activity takes time, and it's a moment-to-moment activity that is infrequent. It's a one-off. It doesn't repeat itself. Each one is life-transforming, and each one is important to us. So why is the natural birth movement so intent on having women be instinctive about birth rather than highly skilled? That has been something that Birthing Better Families have never understood. We need to grow a self-learning, skilled birthing population because we all recognize within our societies that giving birth is one of those incredibly big life experiences. It's an activity that takes place over time, and that it should be infused with rich, deep, broad, usable skills for everybody in every situation. We often hear about oxytocin, the happy hormones, that labor kicks off the happy hormones. There are very few women who are in labor who go, oh, my oxytocin has kicked in and now I'm just happy and I don't feel pain. We have to get realistic about what is happening in childbirth. We lost the plot in the 1980s when we did not couple skills and choices. We lost the plot when we believed that an attitude about pain, not fearing it, would then deliver us an experience that didn't have pain. We have to pick up the pieces now, and we have to go forward. And going forward is simple. Thankfully now, there are a lot of skills-based methods, and we hope that ICPA providers, chiropractors, working with pregnant women will give a handout of all the skills-based methods to their clients, and then mark in their notes which ones they chose, and mark in their notes what skills they've learned, and then talk about the birth afterwards. By talking about the birth, we learn what skills are more effective than others. That's important for us to know. I know you're going to come to the end of this video and say, what were the skills that Birthing Better Families developed around the hows and whys of pain? It was the discussion. It was the recognition that pain and fear, or lack of fear and pain, did not have a correlation. And what was important to understand was that when we felt pain, the best way to deal with it was to have skills so that we could cope, manage, work through, deal with, handle, stay on top of, and feel in control. I am really aware, because Birthing Better Skills developed prior to Ina May Gaskin making comments like, we shouldn't use the word pain in childbirth, we should use the word rushes or waves. It's pain. You can call it a rush, but it's a big rush if it's big. You can call it a wave, but it's a big wave if it's big. And regardless of what you name it, what you are feeling is what you have to cope with. And coping, working with, dealing with, handling, staying on top of, managing are all words that we use around skills. We apply our skills in order to do those things.